9 warning signs of stroke we should not ignore. Strokes are medical emergencies that can have life-altering consequences if not treated promptly. They occur when there is a disruption in the blood supply to the brain, leading to brain cell damage. Recognizing the signs of a stroke is crucial because early intervention can make a significant difference in a person's chances of recovery. In this video, we will discuss 10 signs of a stroke that should never be ignored. 1. Sudden numbness or weakness. Sudden numbness or weakness is frequently observed in individuals experiencing a stroke, and it tends to affect one side of the body. This sudden loss of sensation or strength can manifest as a profound inability to control or move the affected limb. For example, it may become challenging to perform even basic tasks like lifting an arm, smiling, or walking due to the pronounced weakness or loss of control experienced in the face, arm, or leg on one side of the body. This debilitating symptom underscores the urgency of seeking immediate medical attention when it arises. 2. Difficulty speaking or understanding speech. Difficulty speaking or comprehending speech is a hallmark sign of a stroke. When a stroke occurs, it can disrupt the intricate neural pathways responsible for language processing. Consequently, individuals affected by a stroke might exhibit a range of speech-related challenges. These can include slurred speech, where their words become difficult to articulate clearly and coherently. Additionally, they may experience aphasia, a condition that impairs their ability to find the right words or formulate sentences, making communication strenuous. Furthermore, strokes can lead to difficulty in understanding spoken language, leaving those affected struggling to comprehend what others are saying to them, even if they were previously proficient in language comprehension. These speech-related difficulties serve as critical indicators of a stroke's occurrence and underscore the need for immediate medical attention. 3. Severe and unusual headache. A sudden and severe headache, one that stands apart from any prior headaches you may have encountered, can serve as a significant warning sign of a potential stroke. This headache is often described as excruciating and unparalleled in intensity, leading some individuals to label it as the worst headache of their life. Unlike routine headaches, which may be accompanied by tension or pressure sensations, this particular headache may exhibit distinctive characteristics. It can present with a sudden onset of severe pain, often localized to a specific area of the head. Importantly, this intense headache may also be accompanied by a constellation of other symptoms, such as nausea, vomiting, sensitivity to light, photophobia, or sensitivity to sound, phonophobia. These additional symptoms, when coupled with a severe headache, emphasize the urgency of seeking immediate medical attention, as they collectively suggest a potentially life-threatening situation like a stroke. 4. Dizziness and loss of balance. Stroke-induced dizziness and loss of balance represent distressing and potentially dangerous symptoms that warrant careful consideration. When a stroke occurs, it can disrupt the brain's intricate control over equilibrium and coordination. Consequently, individuals affected by a stroke may experience a sudden and disorienting sensation of unsteadiness. This can manifest as difficulty maintaining an upright posture, walking in a straight line, or even sitting up without assistance. In some cases, the loss of coordination can be profound, affecting fine motor skills and making even basic movements challenging. It's crucial not to underestimate the seriousness of these symptoms, as they can indicate a stroke, which demands immediate medical attention to mitigate the potential consequences. 5. Difficulty swallowing. A stroke's impact on the muscles responsible for swallowing can give rise to a distressing symptom: difficulty in the act of swallowing, known as dysphagia. When a stroke occurs, it can disrupt the intricate coordination of muscles involved in the swallowing process. This disruption can lead to a range of challenges during mealtimes. People affected by stroke-related dysphagia may find it strenuous to swallow food or liquids smoothly. This might result in episodes of choking, coughing, or gagging during meals, which can be not only uncomfortable but also hazardous, as it increases the risk of aspiration pneumonia, a condition where food or liquids enter the airway instead of the esophagus. This symptom underscores the urgency of seeking immediate medical evaluation, as prompt intervention is crucial to managing swallowing difficulties and preventing potential complications. 6. Arm weakness. In the context of a stroke, a particularly telling sign is the occurrence of arm weakness, which can manifest as a marked loss of strength in one of the arms. This symptom often accompanies a more generalized weakness in the body, but it's the localized arm weakness that can be especially indicative of a stroke. A simple test to assess this is to ask the person to raise both arms simultaneously. In the presence of a stroke, one arm may exhibit a noticeable drift downward or prove significantly weaker than the other. This discrepancy in arm strength can be alarming, as it highlights the neurological impairment caused by the stroke and underscores the urgency of seeking immediate medical attention for a comprehensive evaluation and potential treatment. 7. Sudden confusion. Sudden confusion is a striking and concerning symptom often associated with a stroke. When a stroke occurs, it can disrupt cognitive functions and impair the brain's ability to process information effectively. This disruption may result in a person experiencing an abrupt state of bewilderment or perplexity, where they find it challenging to understand what is happening in their surroundings or to comprehend the context of their situation. This state of confusion may also encompass problems with memory, where individuals struggle to recall recent events or even their own identity. Additionally, they may become disoriented, losing their sense of time, place, or direction. These cognitive manifestations of a stroke are significant red flags that should not be taken lightly. If someone exhibits sudden confusion or cognitive impairment, it is crucial to seek immediate medical attention to assess and address the underlying cause, which could be a stroke or another serious medical condition. 8. Trouble walking. Individuals who are undergoing a stroke often encounter a distinct and worrisome symptom: difficulty with ambulation. When a stroke disrupts the brain's control over motor functions, it can lead to a sudden and profound impairment in a person's ability to walk. This impairment goes beyond mere unsteadiness. It can involve noticeable stumbling, loss of coordination, and an overall struggle to maintain balance. The affected individual may exhibit an altered gait, where their steps become uneven, hesitant, or irregular. In severe cases, they may find themselves unable to stand or walk without assistance. This particular sign is a paramount red flag, as it underscores the neurological impact of a stroke on mobility and emphasizes the need for immediate medical evaluation and intervention to address the underlying cause and mitigate potential complications. 9. Facial droop. Facial droop is a notable and frequent manifestation of a stroke, often stemming from the sudden disruption of nerve signals controlling facial muscles. When a stroke occurs, it can precipitate the swift onset of weakness or paralysis affecting one side of the face. This abrupt facial asymmetry may lead to a visible sagging or drooping of the eyebrow, eyelid, mouth, or cheek on the affected side. Strokes are serious medical emergencies that require immediate attention. If you or someone you know exhibits any of these signs, don't hesitate to seek medical help promptly. Time is of the essence in stroke treatment, and early intervention can significantly improve the chances of recovery and reduce the risk of long-term disability. If you find this information helpful, please take a moment to hit the like button and subscribe to our channel so you never miss out on our new and